Everybody, welcome to the second part of my series Leading Characteristics. Today I am up here with another drug, the drug Abrotanum. Abrotanum, though it is a very uh, not so frequently used, we found we find it seldom in use, but it is a very important drug. Sometimes when a case come up and that has indications of Abrotanum, we often forget about the drug and we go to the polycrest drugs like for an arthritis or a rheumatic pain, we think of bryonia, rustox, or for a marasmus case of marasmus, a marasmatic child comes up, we think of tuberculinum or iodum, but some we forget that it may be abrotanum. So when we should know the drug properly, and if we know when a case comes, first of all, we have to do the case taking very nicely. We have to take the history, the detailed symptoms, and then we will know that yes, this is a case of Abrotanum and we will not miss it. So let us start Abrotanum. Abrotanum actually belongs to the tubercular group of remedies. Now, what do you mean by that? What are the tubercular remedies? What are the tubercular cases? These are cases or the remedies where in tubercular remedies we find that emaciation, eating well or living well but losing flesh. This is one symptom mentioned by Dr. Allen. What does it mean? That the patient is generally marasmus is a uh, children disease. We find the child it is having enough food, sufficient food, it is eating well. Rather, these uh, patients or these children they have great appetite, voracious appetite. They eat, keep on eating, yet they are losing flesh. So they eat well but lose flesh. That is marasmus. Now there are friends many medicines that are used in marasmus. Like we have tuberculinum, we have iodium, then there is sanicula, silicea, natramio. So we have to know when it is abrotanum. Abrotanum has a characteristic. Here the marasmus, the emaciation starts from the legs, from below upwards. This is the characteristic of Abrotanum. Or sometimes we find only the legs are thin, emaciated in the initial stage. We also find this in other remedies like iodum, tuberculinum, even argentum nitricum, and abrotanum. Just opposite of this, there is emaciation starting in the upper parts of the body, in the neck, face. We find in natramio, in lycopodium, in sorinum. When we see a natramio patient, the emaciation, we can mark it around the neck. The neck is narrow, thin. In abrotanum patient, we find the legs are thin, emaciated. And then gradually as it advances, the marasmus advances, it spreads upwards. So this is marasmus number one. Number two, there are so many remedies having marasmus. What other symptoms abrotanum has? Number two, there is metastasis. It is a very strong feature characteristic of Abrotanum. Now, what is metastasis? Metastasis is a condition where the disease alternates its place, goes from one place to another, or changes its character from one form to another. Like it has glands swelling, parotid glands are swollen, painful. There is mumps, and that changes into mammary. That goes to the mumps going to mammary or the mammary glands or to testes. Similarly, rheumatism leaves the joints and goes to the heart, and endocarditis starts. For a long time, the patient is having rheumatic knee pain in the knees, and when it abates, the heart trouble starts. Again, the piles alternating or piles getting worse when the rheumatic joint pains relieved. Diarrhea alternating with rheumatic pain. And we know another strong feature of abrotanum. It keeps well, the patient keeps well when it is having diarrhea. The patient is having very severe pain in the joints, debilitating pain, but when it is having diarrhea, it is better. So, better during diarrhea. This is we find in Jincum, in natron sulf also. Patient better during diarrhea. So, what we found that marasmus, then metastasis of symptoms, um, that generally, and another in metastasis, another thing we find that is when there is a suppression. Generally, cases where a suppression of the joint pain is done by rubbing of liniments. We often find such things happen because many people use liniments, ointments for the joint pains, and after rubbing it, sometimes it happens. Sometimes the no benefit is found, but sometimes the pain goes away, and that is the one of the most harmful things a person can face. By rubbing liniments, if the joint pains goes away, an obstinate joint pain for a long time it is troubling the patient, and it goes away. And soon after that, we find the patient is suffering from endocarditis, or a cough started, a fever came, along with that emaciations, losing of flesh, that is losing of weight, and then gradually dyspnea, that is breathlessness, and we see that the patient is having pleurisy. Soon after this relief, the patient suffering from pleurisy. It can be endocarditis, it can be hemorrhoids, bleeding piles after suppression of rheumatism. Similarly, after suppression of a long-lasting diarrhea, somehow with something this or that, the diarrhea is relieved. It is suddenly checked by some strong medicine, and soon after that, bleeding piles develop. Soon after that, this severe rheumatic pain in the knee started. A severe cardiac problem started. Now, this is suppression. This is also a type of metastasis. That soon after these suppressions, the disease changes its form into another form and attacks. So, uh, these are 2 points: marasmus, metastasis, disease changing from one form, one character to another, relieved by diarrhea. Another thing very common in children we find is oozing fluid from the navel region with blood. Sometimes blood also comes. This is a feature of abrotanum. Abrotanum children may show this sometimes. And as we said that they feel good, they are relieved during diarrhea. We also find it abrotanum that the patient has alternate constipation and diarrhea. And when there is diarrhea, the patient is better. We find enlarged glands. In marasmus, it is common to find enlarged glands. And as I told, the gland pains shifts from one gland to another. That is metastasis. Now, another important thing, why this, when we say marasmus, why this happens? That the patient is eating well, and another important thing that these marasmus patients they have voracious appetite or voracious hunger. They are never satisfied, keep on eating, yet they are losing flesh. Why? This is due to the defect in the assimilation. They are eating, they are taking food, but it is not properly assimilated. And this disturbance is found in abrotanum also, poor assimilation. Along with that, there is problem in the digestion. Abrotanum patients, they have digestive problems, very disturbed digestion. Sometimes they vomit very offensive fluid matter. They may have uh, eructations, frequent eructations, rancid, sour eructations, gnawing, burning pain in the stomach. Along with that, distension of the abdomen. That is another feature. Now, all this is due to the disturbed digestive system. Now, as all the complaints we discussed, we find that abrotanum, their complaints are aggravated in the evening hours and night, during the night time, and they have intolerance for cold, cold air, cold, wet air. In aconite, we found that exposure to extreme dry cold, patient suffers. In abrotanum, has intolerance or sickness from cold, moist air or foggy weather. They have aggravation. Another thing, along with that, we will see due to prolonged emaciation, they will have prostration, weakness. The patient is prostrated. They are uh, vomiting offensive fluid. Along with that prostration, often it is confused with ethuja. But in ethuja, we see that they have intolerance for milk. The child cannot tolerate milk and it vomits. And due to vomiting, there is prostration. In Abrotanum, it is not so. They like milk. They have craving for boiled milk. And better if they get bread boiled in milk. They have a craving. It is a characteristic of Abrotanum. Now, said so far, um, if you remember all these the main points again, I will recap that losing flesh with voracious appetite, always eating, emaciation starting from the lower extremity. No, sometimes only the lower extremity is found. Metastasis of symptoms, alternating disease alternating, changing from one form to another, from rheumatism to piles, rheumatism to endocarditis, or piles suppressed, hematuria started, piles, hemorrhoids suppressed, rheumatism started, and all these type of things. Along with that, craving for boiled milk. Often we find oozing from the umbilicus or navi, blood coming from navi. And another part is the mind. Now we will come the mind, which is important. Many mathematics have not told, but Allen has told and Clarke has told about the mind. The Abrotanum patient is as just the tubercular drugs like them. Abrotanum is also very irritable, violent, destructive, and cruel, sometimes inhuman. We find the child, it kills the insects, tears the head of the insect, and enjoys it. Or it is beating the pets mercilessly, or it is beating his younger sibling very ruthlessly. We find cruelty in the small children. We generally are they are not supposed to be cruel or so inhuman, but we find sometimes, often we find aboriginal child very cruel and destructive, tearing things, clothes, paper, breaking things, violent. Tuberculum has this, also abrotanum has this, and they are very weak-minded. It is difficult due to this emaciation and prostration. The mind is also prostrated. They cannot think. They are weak-minded. So this is abrotanum. Uh, we have found it useful in marasmus, in joint rheumatic pains, in obstinate rheumatic pains where the diarrhea was suppressed. Just after that, endocarditis, after rheumatic pain is suppressed, all such cases. But these symptoms of abrotanum must be there. In ADHD cases, um, ADHD, that is attention deficit hyperactive disorder, such patients also we find abrotanum often indicated. Hope I have been able to do justice with abrotanum. I would like suggestions or something. If you have experiences, you may please write in the comment box. Next day I will come up with another drug. Till then, thank you so much.